Local leaders and health officials continue to assess the best plan of action for the outbreak. They want to provide as much information and resources as possible to residents. Now, one of those resources is the COVID-19 hotline. So Shatanya Clark looked into this for us today. Shatanya, are those phone lines staying busy?
Melanie, it depends. Folks I spoke with today say they generally see a rise in the numbers whenever a new case is reported, but the calls are generally sporadic, and some callers seem to be seeking comfort as much as information.
Hello, Health District. Will speaking. Can I help you?
William Carter is among those providing comfort for residents with questions about the coronavirus.
They are scared, they are nervous, they really just want to talk to someone, and most of the calls really focuses around what should we do to protect ourselves or scenarios.
Carter said among the most frequent questions come from people who could have been in one of the places where a person who tested positive visited before that person was quarantined.
What if I went to Walmart on the 19th of March, the same store that that person went to? Am I infected? Do I need to be worried?
And with each question, they try to provide an answer.
So what you're going to want to do is call them and let them know that your symptoms are...
Typically, if you're in and out of an establishment, if you don't have prolonged contact, for an extended period of time in close confines with that person, you're at very low risk, but of course call your physician, if you start exhibiting symptoms.
Wichita Falls, Wichita County Public Health Director Lou Kreidler says the hotline seems to be serving a real need in the community.
I think it really has been a great resource for the community. People seem to be appreciative of the information that they're getting and the resolution to their issues.
The hotline, however, is not a substitute to contacting your primary care physician if you have one, if you need medical care or diagnosis. Kreidler and Carter reassure residents that the goal of the hotline is to provide the facts without coloring or hiding the dangers. Now, if you have any questions or concerns related to COVID-19, the number is right there on your screen, 940-761-7909, available anytime between 8 a.m. and 5 p.m. during the week and noon to 2 o'clock on Saturdays and Sundays. Now, this is an important resource, especially for those with no primary care physician.
Yeah, that's right, Tanya. Thank you again so much. Now,